Safety of long-acting beta agonists in asthma. Long-acting beta-adrenoceptor agonists are usually prescribed for moderate to severe persistent asthma in patients or patients with chronic obstructive pulmonary disease. They are designed to reduce the need for shorter-acting beta-2 agonists such as salbutamol or albuterol, as they have a duration of action of approximately 12 hours in comparison with the 4 to 6 hour duration of salbutamol, making them candidates for sparing high doses of corticosteroids, or treating nocturnal asthma and providing symptomatic improvement in patients with chronic obstructive pulmonary disease.
Pulmonary, this is Mary. May I help you?
When researchers launched a new study to look into proper levels of medicine for asthma, Mary Herrick was one of the first to sign up. Not only does Mary work in a respiratory clinic, she has asthma, and like many patients, worries about how much medicine she actually needs.
I've been pretty stable, so I'm hoping that once the study is over, that I'm going to be able to wean off some of my medications.
But that can be much harder than it sounds. When patients like Mary have an asthma attack, doctors often increase their level of medicine to control it, and likely that's where it stays.
The guidelines say wean the person, but no one really says here's a good way to do it.
To change that, Dr. John Mastronardi of the Ohio State University Wexner Medical Center is helping to lead a national study. Researchers know that two drugs, corticosteroids and long-acting beta agonists, work well together in asthma. But what dose is appropriate for each of them, and for how long? Those are important questions because some patients who are prescribed both drugs end up taking neither.
These are medications that can cost them anywhere from $300 to $500 a month. Oftentimes that's a real hurdle for people to stay compliant.
The study will track 450 patients from 18 research centers nationwide. Doctors hope to find the right combination of medicine that is both affordable and able to keep patients like Mary on the path to good health. At Ohio State's Wexner Medical Center, this is Clark Powell reporting.
Applications in medicine. Currently, two long-acting beta agonists are available, salmeterol and formoterol. Both demonstrate bronchodilation extending 12 hours in most patients, while formoterol has a rapid onset of action similar to albuterol. When combined with inhaled steroids, beta-adrenoceptor agonists can improve symptoms.
Okay, so long-acting beta agonists, these are bronchodilators that have a slow onset. They're long-lasting and they're considered controller medications rather than rescue medications. And so it's important that you never recommend these for a patient who's experiencing an acute asthma attack or severe COPD exacerbation. And so some of the long-acting beta agonists you may see on the exam include salmeterol, formoterol, and R-formoterol. And those are individual long-acting beta agonists, but they can also be given combined with an inhaled corticosteroid, such as Advair or Symbicort, on the exam. So be prepared for that. And so what I want you to remember for the exam is to recommend long-acting beta agonists for patients who are already taking short-acting beta agonists and corticosteroids, but they're still experiencing some symptoms. I also want you to remember not to recommend long-acting beta agonists for anyone who's having an acute exacerbation of asthma or COPD.
In patients not controlled with inhalated corticosteroids alone, the addition of a long-acting beta agonist is more effective than increasing the dose of them in improving asthma control and reducing asthma exacerbations. Reduction of inhalated corticosteroids when performed in conjunction with introduction of LABA is safe and does not lead to a worsening of airway inflammation. The majority of asthmatic patients appear to benefit from the use of LABAs, as most subclass may be prone to the deleterious effect.
Beta-2 agonists are used to prevent bronchoconstriction by acting on the beta-2 receptors that lie in the smooth muscles surrounding the airways. When activated, these receptors, through a cascade of signaling reactions, lead to relaxation of the bronchial smooth muscles. Beta-2 agonists augment the actions of beta-2 receptors. As a result, the airway passages open wider, making it easier to breathe. Long-acting beta-2 agonists are not intended to prevent acute asthma attacks. Rather, they are used to complement the actions of anti-inflammatory agents such as inhaled corticosteroids or LTRAs. Long-acting beta-2 agonists are taken via inhalation.
Disadvantages. In children, the benefit is uncertain, and they may be potentially harmful. They should not be used without an accompanying steroid due to an increased risk of severe symptoms, including exacerbation in both children and adults. LABAs should only be used as add-on therapy to inhaled corticosteroids. An increase in asthma mortality was seen when LABAs were used.
In this video, I'm going to talk about mode of action of beta-2 agonists. So beta-2 agonists are actually bronchodilators, good bronchodilators. So these beta-2 agonists could be actually used in the treatment of asthma or other reversible pulmonary diseases. So one good example of these beta-2 agonists are albuterol. It's a prototypic beta-2 agonist, and in this video I'm going to describe how this beta-2 agonist imparts its effect. That means how beta-2 agonist helps in bronchodilation. So bronchodilation means the relaxation of the smooth muscles of the bronchioles. So how beta-2 agonist performs those, and what are the exact signaling mechanism beneath this. So here, for instance, let us assume this dot represent a beta-2 agonist such as albuterol. So this beta-2 agonist bind to its receptor, that is beta-2 receptor on the lung. Beta-2 receptor is found on lungs. So this beta-2 receptor is 7 transmembrane domain protein. It's a G protein coupled receptor also. So when ligand, that is the beta-2 agonist, bind to this G protein coupled receptor, the membrane bound G protein undergoes a conformational change, and the GDP with the alpha subunit is getting hydrolyzed and exchanged with the GTP. Now the alpha subunit bound with the GTP is active, and this activated alpha subunit goes and it activates adenylate cyclase, as we have seen in the basic outline mechanism of any G protein signaling cascade. And then the second messenger cyclic AMP would be generated from ATP, and so on and so forth. The basic mechanism is
Issue applied in Ecuador. According to the World Health Organization, approximately 150 million people suffer from this disorder, and the cases of mortality are around 2 million each year. And in Ecuador, it is estimated that asthma affects 7% of the population. According to figures from the Ecuadorian Institute of Statistics and Census, in 2010 there were 3,275 cases of this disease in the country. Nowadays in Ecuador, long-acting beta agonists are used for the treatment in chronic obstructive pulmonary disease and asthma.
same. So what is the physiological effect of this mechanism? So these whole signaling pathway will impart two physiological effect. One is it inactivates the myosin light chain kinase. This myosin light chain kinase is actually important for muscle contraction. So if these myosin light chain kinase or MLCK is inactivated, then the muscle contraction could be prevented and decrease in intracellular calcium, and in a moment we will see how these two effects are actually regulated. So in normal cases, calcium would form a complex with calmodulin, and calmodulin will activate this MLCK, that is the myosin light chain kinase, and the myosin light chain kinase will phosphorylate the myosin light chain. When myosin light chain is phosphorylated, it can form cross bridge with actin, and the result would be muscle contraction. Now what happens? As a result of beta 2 agonist binding to the receptor, it imparts a signal which tells the cell to inactivate the myosin light chain kinase. So once the myosin light chain kinase is inactivated, what happens? This phosphorylated myosin light chain is not formed, and these cross bridges are not formed. So muscle contraction cannot take place. So thus, beta 2 agonist mediated signaling preventing the muscle contraction, and ultimately it imparts the effect of bronchodilation. It also decreases the calcium 2+ level and indirectly inhibiting the muscle contraction. In this way, beta 2 agonist such as albuterol imparts its effect by causing bronchodilation. Hope you liked this video and you have enjoyed. Thanks. Like please, and please subscribe.